Welcome to the Healthy Chicago podcast, a discussion between city health professionals and weekly guests discussing topics affecting public health in the city of Chicago and around the world. All right, welcome Chicago to this new format that we're trying out. This is the Healthy Chicago podcast, and I'm here today with Dr. Tiema-Massie. Dr. Tiema, welcome.
Thank you.
Again, my name is Dr. Brian Borah, so I am a medical director for the Chicago Department of Health in their Vaccine Preventable Disease Surveillance Program. Dr. Tiema, can you tell us what you do for the health department?
Sure. So I'm Jacqueline Tiema-Massie, and so I work as the Immunization Program Director with the Chicago Department of Public Health, and I've been in my role for a little over 2 years.
Awesome, awesome. So what does that mean? Like, what do you do on a day-to-day basis then?
Awesome. So since I came on board during COVID, most of my work has focused on COVID-19 vaccine operations.
All right.
So supporting our at-home program and various other COVID-19 related programs to vaccinate the public, and also operating our standing immunization clinics. But in addition to that, there are everyday regular vaccine preventable disease programs that we also operate, including our Vaccines for Children's program that provides free vaccines to over 300 providers citywide.
Wow. Well, you've been busy, I think, the last couple of years then,
Yes.
huh? Let's talk about COVID then to start. Is it over? You know, I think some people want it to be over, certainly. What's the landscape right now? And, do we need to go out and get new vaccines?
Yeah, COVID is definitely not over.
Okay.
I think our Epi unit was recently sharing with us that we've had over 4,000 Chicago residents that were hospitalized since January with COVID-19 infection. So a lot of us remember when we had family members and loved ones that were hospitalized, or even, unfortunately, knew people that had died from COVID back in the beginning of the COVID-19 pandemic. But we still do have people that are being hospitalized with COVID. Not as much as previous years, but we still do have that. And since January, we've also had about over 150 residents, Chicago residents, died due to COVID. So we are definitely recommending that everyone 6 months and older be vaccinated with the new COVID-19 vaccine.
Okay. And tell me a little bit more about this vaccine.
Sure. So since the middle of September, the CDC recommended, after the FDA approved, a new updated COVID-19 vaccine. So we're calling it not a booster.
Yeah, not a booster, right? Different than the old booster.
It's different than the old bivalent booster. It's a monovalent vaccine, and it includes the current circulating COVID virus strains.
Okay.
So it's supposed to protect you from the current viruses that are circulating.
Totally. Yeah. So it's been like specifically designed for what's out there right now, right?
Specifically designed.
And what about the old vaccines? Are we still using those?
No, the old bivalent vaccines are no longer valid, and this is as of middle of September, I believe September 14th. And the new monovalent vaccine is the vaccine that everyone needs to receive. So if you've received COVID vaccines previously, before September, you are due for a new COVID vaccine.
In fact, I am scheduled to get mine today.
Awesome.
With flu.
With flu.
Yeah, and so let's talk a little bit about that. So it's safe to get both together, right?
It is safe to get both vaccines, and we actually recommend that people just knock both of them out.
Yep. Most
of our providers are offering both, so take advantage of the availability of both.
Perfect. Yes. So we know that CDC and various other organizations have done a whole lot of studies looking at the COVID vaccine and the flu vaccine, and looking at giving them together, right?
Yes.
That's been shown to be safe across the board. So I think it's the easiest and fastest way just to get them done, right? Knock them out. And so my appointment's at 3:45 today. I'm
Awesome.
Looking forward to it, yeah.
And I got mine on Monday.
All right, there you go. How'd you feel afterwards?
I felt fine.
Good.
I felt fine.
Yeah.
You never know if you may have a sore arm.
Right.
Or if you may just feel a little, slight fever. But I didn't. I had a sore arm a little bit, but that was it. So it was not bad at all.
Yeah, I think like in the past, I don't know, the first couple hit me pretty hard, I think. I had like a day, where I was a little bit, out of it, but but otherwise I've been okay, you know, and we're both still here today to talk about it. So,
I love that you're being transparent about that, because I think sometimes the public is concerned about, you know, the after effect, the side effects with receiving both vaccines.
Totally, yeah. Well, there are a couple different options of vaccines for COVID this year.
Yes.
Let's talk a little bit about those.
Sure. So both Moderna and Pfizer and Novavax recently also got approved. So there are 3 options that the public can request through their doctor's offices or at local pharmacies. And then the city is also operating a number of clinics citywide. So we kick those off at the end of September. And so those are occurring at aldermanic offices, city colleges, our immunization standing clinics. So there are lots of options of where you can get the COVID vaccine of your choice.
Cool.
We just recommend that people phone ahead because there have also been a few supply issues. So, you know, COVID vaccine went to a private model. So previously the U.S. government was providing that free for everyone. But since the privatization of COVID vaccine, providers are purchasing their own stock as well as receiving some federally some federally supplied vaccine as well. So we recommend that people call before they go.
Got it. But just to be clear, the COVID vaccine should still be free for most everybody out there, right?
Yes, yes. And so the difference this time is that your provider may ask you for your insurance and bill your insurance. So that's the main difference this time. But at all of the city-operated events, we are providing it regardless of insurance, regardless of immigration status. Folks can feel comfortable to come out and receive their free vaccine. So those events will be ongoing through December 9th.
Great, great. And my understanding is for folks with private insurance, if they go to their doctor or pharmacy, best to try to make sure that it's in-network first, right?
Yes, they should definitely make sure that it's in-network first to make sure that they won't come out of pocket, of any, additional charges. And that's the easiest way to, confirm that your vaccine is fully covered. But for those that are uninsured and underinsured, definitely feel free to come out to any of our city locations and we'll be happy to serve you.
Cool. That's great. I've heard great things about those clinics. And, we're seeing the uptake of this COVID vaccine right now. Still, we want it to be higher. I think it's around 5% of Chicagoans have gotten their vaccine. So, definitely not where we want to be, but people are going out and getting this vaccine, and we encourage everyone to go out and get this vaccine.
Yes.
Great. What about if somebody recently had a COVID-19 infection?
That's a great question. Several months back, my whole family got infected.
Are they doing okay?
Yeah, they were definitely doing okay.
All right, good,
so I know that there have been some recent infections, and folks may be concerned about whether or not they would be eligible to get the vaccine. So the general recommendation is that you should have at least a 2-month gap from when you were infected to when you get the vaccine. But if you have any questions or concerns because of any particular health conditions and issues, definitely feel free to talk to your provider, your doctor, or your local pharmacist.
Got it. Yeah. And I don't think it's like a hard and fast rule. I think you can still go out and get it, but like 2 to 3 months is generally like the
general.
Yeah, perfect. And then what if you just got a vaccine like in August, right before these new ones were approved?
So still the same thing. You still need to wait about 2 months before you get your new updated COVID vaccine.
All right, great. Well, how's the rollout been going then? I mean, have the clinics been well received? Are you getting
folks? The clinics have been well received. And I think you brought up a recent clinic. So we hosted a clinic last Saturday at Wright College. And we were at capacity, over 400 people registered, and we also accepted walk-ins. So, we do recommend that if folks are interested in any of the Chicago events, that they look those up at chi.gov/flu. And register. So we recommend that people register as much as possible to ensure that you have an appointment.
So they go to this flu website, but they can sign up for both flu and COVID?
Yes, they can sign up for both flu and COVID.
Perfect. Awesome. Well, great. We're just coming, off from a little bit of a COVID wave, or a bump, I should say, right? So COVID has been in the news a little bit more. And but again, like if you just had COVID, you have this grace period to wait a little bit and can try to time it out. But we are expecting, as the weather gets colder, as people move indoors, we are anticipating, an increase in all respiratory viruses, including flu, COVID, and RSV. So we've talked a little bit about COVID and a little bit about flu. Well, why don't we talk a little bit about the flu vaccine? Anything in particular, is there any hiccups for the flu vaccine rollout this year?
No, we have ample supply of flu vaccine,
Okay.
and that's everywhere. So not only at our health department events, but also local pharmacists and providers should also have ample supply.
Great.
And I think the plus thing to say about flu is that it's a similar schedule to the COVID vaccine in that as long as you're 6 months and over, you're eligible for the flu vaccine as well as the COVID vaccine.
Perfect. Awesome. I guess I think a lot of people have been hearing about this bridge program, and I think you mentioned it a little bit, but maybe we could talk about that program in particular in a little bit more detail. What does that mean?
So the bridge program. So the federal government, specifically the CDC, developed a program called Bridge, and Bridge really was to bridge us from the U.S. supplied the COVID vaccine to an adult vaccine program, which is still, the main goal, and many federal partners are working towards that.
Okay.
But to ensure that folks that could not afford to buy the COVID vaccine would still be able to get the COVID vaccine, so those that are uninsured and underinsured, they developed the Bridge program.
Okay.
And so how that works is that the CDPH receives a number of doses, and also several pharmacies also receive doses. So Walgreens and CVS are also participating in the Bridge program, and there are a number of third-party additional pharmacies that are participating in Bridge. And again, this is to vaccinate those that have no insurance or are underinsured.
Adults in particular,
Adults.
right?
Thank you.
Okay.
Yes,
Perfect.
adults.
Perfect.
Adults. And so we have a similar program for children, and so that's our Vaccines for Children's program.
And that's been around
that's
for a
been
while,
around.
right? Okay.
That's been around, and that covers not only COVID vaccines, but all recommended and required childhood vaccinations.
Okay.
So that's
Okay.
for children under 19 that are on Medicaid, uninsured or underinsured, or Alaskan Indian Native. So
Okay.
I was wondering from a clinical perspective if you can describe, I know under certain conditions or circumstances, folks need more than one COVID vaccine. So can you talk a little bit about that?
Sure. Yeah. So the recommendation is easy if you're 5 years and older and you're not immunocompromised. You just need one of these new COVID-19 shots. If you're under 5, it depends on sort of your previous history of COVID vaccinations, and it depends on what type of vaccination. So there's different recommendations for Pfizer and for Moderna regarding the number of shots that you need. And then if you do have an immunocompromising condition, there are some recommendations that you could benefit from additional shots. So if you fall into either one of those two buckets, I would just encourage people to reach out, talk to their provider or their doctors, to get information specific for you, basically. But for most everybody out there, 5 years and above, you just need one of these new shots.
Got it. And you raised another question, and that is, so pregnant women, is it safe to take the COVID vaccine?
Yeah.
If you're pregnant or if you're nursing?
Yeah, great question. So, pregnancy, has some effects on the human body that lowers, your immune response and puts you at a state of, somewhat of a state of immunosuppression. So actually, being pregnant is considered somewhat of a risk factor for severe outcomes of COVID. So yes, we absolutely encourage folks who are pregnant to get this new shot. It is safe during pregnancy. We have a lot of data, at this point, a couple years into this pandemic, showing that the COVID shot is safe for folks who are pregnant. So yes, we do recommend that.
Got it.
Yeah.
Another question I think that the public would like to know,
Sure.
we've been hearing this buzz term of respiratory virus season.
Yeah.
Can you explain what that means?
Sure. Yeah. Well, and last year we were hearing a lot about this triple-demic, right?
Yes.
So last year what happened was we had COVID, we had flu, and we had this virus called RSV that all basically peaked at the same time or a very similar time. And all these viruses cause somewhat similar symptoms, or at least there's overlapping symptoms. All of them are respiratory viruses, so Oftentimes people are coughing, they have a fever, they have chills, things like that. But what happened last year was that all three viruses basically happened at the same time. And they put a lot of people in the hospital, and our hospital systems were having a hard time for a little bit keeping up with these hospitalizations and being able to provide resources for everybody that needed them. So we are trying our best to avoid that this season. All three of those viruses still exist. The good news is, right now in Chicago, we have low levels of COVID, we have low levels of flu, and we still have pretty low levels of RSV, although that one looks like it might just be increasing right now. Got it. But we want to take precautions this fall to protect ourselves from these respiratory viruses, and so we've sort of we're calling this, we call the fall season the respiratory virus season because that's when we normally get the peaks of some of these viruses. The really unique thing and the really, big opportunity this year is that for the first time in history, right, we have vaccines for all three of those respiratory viruses. So I know we've talked about flu and COVID vaccines. What can you tell us about RSV vaccines?
So that's a great question. So with the RSV vaccines, there are 4 RSV vaccines. And so those are to protect our seniors that are 60 and over. There are 2 variations of that, one through Pfizer and one through GSK. There's also one for our pregnant women as well.
Okay.
And that's an RSV product that was created by Pfizer. And lastly, there's an RSV product for infants as well.
The time is now basically to go get vaccinated. Like we said, we're expecting these viruses to increase in the coming months, and getting vaccinated is absolutely the best way, to protect yourself against these viruses. And I just wanted to make a point as well. So the RSV vaccine for pregnant people, that's actually intended to not only protect the pregnant person, but also the baby, right?
True.
So the idea is that a person who is pregnant, who's about to give birth, can receive this vaccine and be able to pass antibodies along to their baby once they're born. So it's really an amazing technology.
It is.
So I'm really excited to see how these vaccines work in real life, and how we can get these to people who need them the most, and hopefully we can see the effects of decreasing the overall virus levels this fall.
Yes.
Dr. Tiema, what else? Is there anything else? Any other questions for me that you have?
I think you've covered most of my questions. I think maybe just one, last question. We're approaching the holidays.
Yes.
I know you talked about going indoors. And that's when we're, mostly around family and friends. Do you have any recommendations for people around that and how to best protect their family and friends?
Yeah, for sure. So, like any time, but especially now when we're entering this respiratory virus season, if you're feeling sick, I think there's a few things you can do. Number one, if you're feeling sick, we encourage you to stay home. Don't go to family parties, especially if there are folks around there who are high risk of getting severe illness. So folks who are, elderly, folks who are immunocompromised, little babies, pregnant people, things like that. So those are the folks we really, we want to protect the folks in our families and our communities that are highest risk for getting severe outcomes. So number one, we can stay at home. We can also test ourselves. A lot of people now still have COVID tests at home. So that's one way of knowing whether you have COVID or not. And if you do, again, the recommendation would be to stay at home. And of course, masks are still an option for everybody. So we encourage people to have access to a mask. If you're feeling ill and you're going to be around other people, we encourage you to consider wearing a mask. It's one additional way to protect those around you. And ventilation. So I mean that gets a little bit harder in the winter, right? You can't just open up a window. But any way you can increase the airflow through a room is a good way to decrease the risk of getting a virus.
Awesome. So a lot of the things that we did when COVID was at its height.
Yes. Yeah. So all those things still apply. But again, the number one thing that we can do is get our COVID vaccines now.
Yes.
And get our flu vaccines now. And if you're eligible, go out and ask your doctor about the RSV vaccines.
Got it.
Well, Dr. Tiema, thank you so much for joining me today.
Thank you.
This is such a pleasure, and I hope we can do it again.
Awesome. Thank you.
Yeah. That's our show. Thanks for joining us here on Healthy Chicago Podcast. Please subscribe to CDPH on your social media. And please remember to rate the program wherever you get your podcasts or on YouTube.